Hello, everyone. I'm Wendy Liebmann. I'm the CEO and Chief Shopper at WSL Strategic Retail, and this is Future Shop. This is where I talk to innovators, disruptors, and iconoclasts about the future of retail. Today, the topic is healthcare. That's a political, landmine, right? Well, it's more closer to home, as most of us deal with it in this listening and viewing audience. We're going to talk about the need for retail healthcare to be disrupted. It's being disrupted, or it needs to be disrupted, whatever it is. There's a lot of change coming along. There's so much going on in terms of conversations around self-care and women's wellness and digital care and incentivizing people to take better care of themselves and food as medicine and all of these extraordinary things. So I thought it's really time to level set the conversation, or at least push it forward. So I'm really excited today to have with me somebody who has a very unique purview on all of this. She is Susan Lang. Susan is the founder of XIL Health. She founded this women-owned healthcare analytics and technology company. She invests in healthcare startups. In her prior life, she was one of the senior executives at Express Scripts and really has spent her entire life working in healthcare. So she has an extraordinary lens on what is going on in terms of the future of retail healthcare. And so I am just absolutely delighted to have her with me today. Hello, Susan. Welcome.
Hello, Wendy. Thank you. It's so good to be with you.
Yeah, we had one of those kismet kind of meetings along the way at NACDS or somewhere else through the lens of our good friends at Kroger and Colleen Lindholz, which was a great meeting. And so you and I have continued that conversation. What struck me about that and what so intrigued me about your background is you have both this extraordinary, I'm going to call it technical expertise. Sorry for that. You'll explain some of that in a minute. But you also have a very personal view to healthcare. So can you give me the short version of both of those?
Sure, I'd be happy to. So what Wendy is talking about is I ran hospitals, large community hospitals, not-for-profit, for about 22 years. And when I was 33 years old, I was on my way to a hospital board meeting, and I got hit head-on by a drunk driver. And I had a head injury, serious head injury, about 16, 18 fractures. I had to be air-vac to a regional medical center. And I was out of work for a little over a year and in physical therapy for 5 years after that, and was told that I would never walk again without an assistive device or work again. So I went from running hospitals to being a patient for a very long time.
And that, I think, is so interesting because if you meet Susan, see Susan, she's one of the fastest movers I know, both physically and mentally. So it's just extraordinary, this story. But that's what I mean when I say she has a unique purview on all of this, because she's been at both sides of this extraordinary ecosystem that we live in when we talk about healthcare. So thank you for that devastating but inspiring snapshot of life in Susan Lang world. So, when you think about all of this, you today are very involved with some very large clients and retailers in terms of their PBM business and the way they strategically manage that. But you also are invested in physical therapy clinics. And I think about that as I sort of step back and think about what role do you see retail playing in delivering better, more affordable healthcare to people these days? Or do you?
Oh, I absolutely do. And if you think about the shift, there's been a 20-year shift away from hospital systems to local freestanding centers, now to retail. And one of the amazing things about retailers is they're everywhere. They're in your neighborhood. So it wouldn't be possible to replicate that footprint today in healthcare by putting a clinic in every single neighborhood. It's just not possible economically and financially. So really, if you think about retail, they're on the forefront of community access to care and hopefully affordable access to care, both for primary care, and then how you really rethink that retail space in terms of people taking control of their healthcare. So one of the things that happened with me and my care is, as a patient, it was a long time ago, but you want to be in control of your care. And we're seeing that now play out in retail, where people want to control, consumers now, not patients, want to control their healthcare. And that's going to be the big shift for retail for the next 10 years.
That's so fascinating to me because we certainly hear people, we hear our CPG clients and our retail clients talk about self-care, and it feels like such a sort of, I don't know, airy fairy term. In fact, it feels like, I always say it feels like, oh my heavens, one more chore for me. But
Sure.
the way you talk about it in terms of taking control of my own health as an individual or a family, that sounds like a very powerful model. Can you talk a bit more about that and what you're
Sure.
seeing there?
So if you think about just fundamentally what healthcare is, or health, your health today, it is your ability to take care of yourself and your family. It's such a fundamental requirement we all have to live our best life, regardless of your health status. It's how can you do as much as you can do, the things that you want based on your health status. And when you go into a hospital system or you go into a complex system, you lose that personality, you lose that individual drive, and you're allowing other people to make decisions for you. And consumers today don't often want that. And part of the reason is we have democratized healthcare information and health data. So when I was running hospitals back in the day, women and children's hospitals, I had physicians tell me, for instance, women were not smart enough to really learn about and control their own healthcare. Today, if you Google health, on the internet, you will see 14 billion with a B sites on health information. So as that information has spread, consumers really want to understand what their options are, how much it costs, how frequently they have to go, and how much can you do in your own home or, again, in your local retailer or online. So you're not forced into sort of these impersonal situations in traditional healthcare settings, honestly. So that's where we're going.
So that to me, first of all, since we both run women-owned companies, we're
Right.
thoroughly insulted by that prospect, right? Thank heavens that's done,
We're,
sort of.
we're long past that. That was a long time ago. So we've
Thank
moved way
heavens.
past that.
Well,
Hopefully.
we hope,
Yeah,
right? We hope.
that's right.
But those days of WebMD, right, have now exploded. I mean, we see
Exactly.
that in all our How America Shops research. We see the extraordinary
Absolutely.
number of places people report they go to for health information,
Right.
from podcasts to, websites to, a
Sure.
whole slew of different places. How do you see that when you envision what a retail environment, that store on the
Hmm.
corner, clinic
Hmm.
or no clinic, looks like? How does that change? Now we place so much store on the poor old pharmacist, young pharmacist, whatever, at the back of the store.
Hmm.
How do you see that sort of journey evolving now with that access to information?
Yeah, I mean, if I actually look out in the future, what I envision, it's not exactly here yet, is combination of a couple of different trends. So the trend of telehealth combined with the trend of wearables, which is consumers that want to see their own functioning, how they're doing in their own body, whether that's their blood pressure, the respiration, their pulse. It might be an EKG machine, whatever they want. They
Hmm.
want that themselves to be able to wear that and to know immediately. I also see people now, it's so interesting. The Libre, there's a device you use for diabetics. You put it under
Hmm.
your arm and you can monitor your blood sugar. People that are perfectly healthy are using this now because they want to see what is happening with their blood sugar, because they want to stay healthy. They want to keep their energy up. They don't want to gain weight, all these different items. So if you think of a retail store, I do think the whole front end of that store needs to be reimagined so that you could have potentially a smart store where you had a pod. I mean, if you think about this, you could go into a pod, you could rent the pod, you could pay a fee, you step in like you would an old photo booth, and you get your primary care visit is done on screen. Everything's monitor for you, including your blood pressure. You get your script, you walk out, you fill the script, and you're out, and you've just had a primary care visit, right? So
Mhm.
that's a completely different way to think about, again, distributing healthcare, especially primary care, into a retail setting. So somebody could go into the setting and have that done. Because one of the issues with telehealth, from my perspective, so I've tried it just to see what that experience is for the consumer. The doctor said to me, "Oh, do you have a blood pressure cuff? Can you take your own blood pressure?" Okay, not everybody's going to be really great at that or accurate or have that at home. But if you could step into a pod, all that's taken for you, the information immediately sent to you, immediately sent to your doctor, talk to the doctor online, everything's done. You're in and out in 15 minutes.
Mhm.
I think it would be brilliant. So I do think the front end of these stores, from a product perspective, has to start moving to service.
Yeah.
And beyond service, has to start moving to data really is the product.
Yeah.
People want their data, and they want insights on their data, and they want to understand when data is being collected, even on their wearable devices, where's it going and who's using it and how does it benefit them. So I think that's a whole new challenge to start to think about, but I think it's actually really exciting when you think about that.
Yeah. So do you see anybody beginning to experiment in that space?
We do, and we have experimented. So we have, as Wendy said, I'm the CEO of XIL Health, which is an analytics company, healthcare analytics and technology. We also own a what we call cash access platform. So the other trend is people moving to paying cash. They don't want it at their insurance company. They don't want everything through their employer. They are willing to pay cash for primary care, cash for prescriptions, which is Visory Health. But we also have invested in physical therapy clinics. We have talked to pharmacies about putting wellness physical therapy in the front of the store. So wellness physical therapy would be, as you age, you need strength training. You need fall precautions, right? There's just a balance. You need a few things that doesn't require in-depth physical therapy, but you could come into a store, do a quick class, get a consult and go home with your exercises and not have to do a full physical therapy visit, which is cash, right? Because everybody needs that as they age, and most people aren't getting it. And it would be much more affordable than home health. So if you think about the way healthcare's moved, it's gone from hospitals, everything in a hospital, out into the community. And every time we change the site of care, it gets less expensive. The least expensive care is in your home. But now you could actually say we could do something in retail for the community that would also be very, very cost effective and comprehensive. So we are starting to see people, and we've had people, Wendy, say to us, yeah, we really want to think about that. We want to think about that square footage differently than we've thought about that before. We think it creates stickiness. We think people will stay in the store longer. You may come in, we have that sandwich generation of people caring for their parents. Maybe they walk in, they drop dad off, they finish shopping, they come back and get dad. He had his 15 minutes. It's great. It's easy. They don't have to go to 2 locations. There's a lot of benefit to that. So that conversation is just now starting, but I think it would be really interesting to see where that goes.
Yeah. And I do think about it within the context of the whole discussion about caregivers. Some recent research, I can't remember if I was talking, I should remember the source. I can't remember if I was talking to you or talking to somebody else, but that whole conversation around millennials and
Right.
this conversation that, 30% of millennials anticipate that they will actually be playing the role of caregiver, within a very short frame of time. So that sandwich generation,
Right.
the urgency for that kind of care becomes even greater. The sort of, when you talk about this, your vision for this and the store, is this, so for the individual who comes to that, I mean, one of the big issues is, right, the cost of healthcare. And
Right.
who do I trust to deliver it to me? We see in a lot of our work that people say, yes, I go to the doctor, I go to the nurse practitioner, I, go to the pharmacist. And while I trust them for certain things, I don't trust them as much to give me good, smart health advice. So is that what's also driving people to do, from your point of view, so much more of their own homework before they even show up? Is that the other piece, this level of trust?
I think it's the level of trust, and I think it's the level of consultation. So if you're going to a doctor's office, so if you think about physician practices, that model was started after World War II. They were not built for the sheer volume of throughput coming through their office. And so we've had care extenders, like you said, so physician assistants, nurse practitioners. But you see the doctor for 5 minutes. The doctor is treating whatever you were in the office for at that moment. They are not saying, here's your wellness plan. Here's to live your best life for the next 12 months. Here's things you can do that will really help you and improve your energy level, your sleep, all these things that are so important, right? Your nutrition that affects our health. I think people are still looking for the consultation in that. And I think, for instance, retail pharmacies, grocery store pharmacies, we know the public really trusts pharmacists. We know that those are caregivers people really trust. It's the same thing with physical therapists. They really trust because you spend time with them.
Right.
Because you can talk to them, because you can consult with them, they can ask questions. So it's a little different, and it's not as intimidating as sort of questioning a physician maybe in an office or somebody in a hospital. So again, I think getting to that local community neighborhood, the neighborhood person down the street from you. I used to tell people my grandmother retired in Florida, small home, and her local pharmacy delivered her meds every week. The pharmacist would check on her. And I loved that guy because it was one less thing. If I'm a caregiver taking care of my mom and dad, if I'm a millennial, we also know, by the way, even not millennials, right now, there's somewhere between 30 and 35 million Americans caring for parents. Mm-hmm. I'm one of them, right? My parents are in their 80s. They're still doing great. They live in their own home, but we still are making sure they're as healthy as they can possibly be and wanting care. My father just had physical therapy for balance, and it's helped tremendously. So if you could get that out in the community to stop people from falling, and you can drop that person off for a short time where you get a break and do your shopping, you're not worried, they're in safe hands, they're feeling good about where they are, they have more interaction. For seniors, that's phenomenal, right? That's a phenomenal idea. The issue is, how do you make it work per square foot, right? How do you make the economics work per square foot in a store? That would be the thing we'd have to look at. But I think you can always make the economics work eventually, right? So long as you're not, sending people out to people's homes. I saw a model where they were trying to have doctors do office visits again to people's homes. There's no economics that makes that work.
Well, that's part of what, we certainly saw during the pandemic, how we were doing more virtual health and people sort of lent into that because they didn't have other options. And then finding that for a lot of visits as a very viable alternative, as long as they got more than 2 seconds. Somebody was telling me they spent more time with an online vet for their pets than they usually do in the doctor's office. So those sort of things we've learned during crisis, I guess, that really make a difference. I do think the other topic that we've been hearing so much about from everybody in our client world, and from shoppers, but more from the clients, is this notion around broad topic called women's wellness. And I know this is an area that's also, in terms of some of the work you've been doing and the investments you've been making and the scholarships you've been working on with, I think, Bank of America, those sorts of things. People are starting to say to us, well, what is women's wellness? Is it, menopause? Is it prenatal to menopause? Is it sexual health and wellness? How do we think about that? It feels to me like it's everything in the store, right? It's all about.
Well, and women. This is why we started Advisory Health. So Advisory Health, the first component of that is a discount pharmacy card geared toward women who are taking care of their kids, their family, their parents, their community, and who aren't taking care of themselves. And what we wanted women to know is that COVID was really hard on moms. It was really hard on everybody. It was really hard on moms. Their kids are in and out of school. The school shuts down. They couldn't work. A lot of people had to withdraw from the workplace to take care of their families. So we wanted them to know that we see them and we hear them, and what they need to do is take care of themselves, because they cannot take care of their parents and their kids and their family and their community if they're not well. Right. So this is really this is sort of a passion of mine. I've worked in women's health for many, many years. We have to start thinking about the whole person, and whether it's controversial or not, mental health for women, autoimmune diseases for women, moms, what is unique to moms, what is unique to seniors. So we always said cradle to grave is what we always said. But really, I think about it. I think about sort of women from 16 years old. I think about adults, right? Not pediatrics, but 16-year-olds on. So that's reproductive health. That's having starting your family and making sure that you start your family and have a safe pregnancy and a safe delivery, which again, I did for years. I ran a women's healthcare program where we delivered 6,000 babies a year, all the way through, going back into the workforce, your kids get older, and then how do you take care of yourself and take care of your parents as they age? So this is an area that it's shocking to me because I had these discussions 30 years ago and we're back to the same discussion.
Good. Right.
Right. So
Yeah.
that's surprising. I mean, is that what what are you hearing out there, Wendy? What are people telling you?
Exactly that conversation. And as you described that, I could instantly see what a physical space in a store would look like. I mean,
Mhm.
I could,
Right.
with the technology support and the sort of digital experience that goes with that. But we always say, follow the shopper to see the future.
Sure.
And within that space, I can absolutely see the way a store would be designed. When you think about the
Right.
majority of shoppers who come into any store, a drugstore, a supermarket, a club,
Right. Right.
any of mass merchandise, any of those, department store, that if you think about who that shopper, patient, customer, caregiver is, it's generally a woman with lots of things on her plate. And I can, as you described that through her life, it reminded me years ago, Target decided that they had baby care all over the store. They had
Right.
diapers over here, and they had,
Right.
what do we call them? Strollers and beds and children's clothes, and everything
Right.
was everywhere. And they finally convinced the buyers or somebody in senior management that, okay, nobody owns the territory. We're going to bring it together through the lens of, in that case, Target Guest.
Yes.
And everything she needed for as a mom was going to be in that one place.
Right. Right.
And they did that. And then I think Walmart followed suit and things. But then I thought about, well, what about the rest of the store? That's a moment and a long moment, but how do you build that out? So anyway, the long and long of that was listening to the way you described it. And I'm thinking, people now are talking about, is it vitamins? Do vitamins go in women's health and wellness?
Right.
Where do tampons go, women's health? I mean, it's seems
Right.
like the wrong question they're asking, as opposed to who is this person and how can we support her in her whole life? So, as you said, cradle to grave seems a very good lens to have.
And women make 70% of all healthcare decisions in this country, which is also shocking when you
Yeah.
think about. I look at the ads on TV for healthcare, and there's a Silicon Valley formula that you have seen where there's a young guy in a t-shirt and nice jeans and maybe a jacket who's selling everything in healthcare. And it just is shocking. So no women, they're not even represented. So that's still surprising to me. So again, that's our company is women owned, we're women led. We really want to hear the voice of what women need at each stage of their life and how we put those supports in place. We have talked to a couple large healthcare systems. We won't say who, it's in development, but could we do care packages through subscription? Okay, so you're having your first baby. What do you need to come every month that you haven't thought about to help you feel better? What you need to come for the 12 months after you have your first child? What you need if you're going through breast cancer, right? Do you have ice pops in your freezer because we know that chemo, it's going to affect your mouth and you get all these different things that could be done so easily that you wouldn't have to learn yourself. Every new person who gets sick, they're on this journey to discover what does it mean? What's the progression of that care and what does that mean for them? Could we circumvent that somehow and put those things in a store where they could come in and get them all in one place, possibly in a package even delivered to them, which would be even better. Those are the kind of things that, we're really thinking about and trying to rethink that whole women's health space. So it's not just about having a baby.
Yeah.
That's a big part of it, but it's about, like you said, premenopause, menopause, what happens as you age. Are you taking your vitamin D? Do you have osteopenia? What is your situation, right? We don't talk a lot about that. It's surprising. But again, I think it's going to take a retailer with real vision saying, can they carve out a niche for themselves? Because nobody really owns this space.
Yeah. Yeah.
I also think in retail, we need to start discriminating by demographics, meaning most retailers I've seen have a single floor layout, right? So it doesn't matter if you're in rural, suburban, urban, it's maybe more or less square footage, but everything goes in the same place. It's the same. But what if you actually targeted to, I'm in a rural community, I'm women in a rural community. That's a little different than I'm a suburban mom. That's a little, right. We actually haven't done that level of customization, but the way we started our conversation is consumers want control, and that means they want it targeted to them and customized to them. How does retail adapt to that?
Yeah.
Even on a demographic level, right? So I think that's new territory for most retailers, frankly.
Yeah. And I think what's interesting about it is you'll get part of that story. Excuse me. Sorry. You'll get part of that story, and you'll get it in the sense of, we've got busy households, busy families, busy somethings as part of that
Right.
discussion.
Right.
But it doesn't really understand the lifestyle and the specifics of the community people are in, how much access they have. You're right. There's
Exactly.
this frequency of, we carry these kinds of products. We have a pharmacy. We don't have a pharmacy, those kinds of things.
Right.
And as much as retailers, who we love desperately, talk about their shoppers, in fact, they don't. It's still very much around the efficiency of the operation,
Right.
and obviously the financial efficiency, which I get, not naive enough to
Right.
think that's not important, but that lens of who are the people in my 5 miles around my store and what can we deliver
Exactly.
to them becomes so
Local,
important.
local.
Yeah, yeah. And so all the people who are listening to this are now in the CPG space are going like, oh my God, so many
What are
services.
we
Where are we
talking
going to
about?
sell our products, right?
Yeah.
Feels like the products have a greater legitimacy because they connect to what,
I agree.
yeah, right?
I also agree. I saw a model. I'll just share this really quickly. There was a model, a small community. So if you think about healthcare in rural America, hospitals have closed, clinics have closed, poor access to physicians. Same thing with grocery stores, right? So food deserts, pharmacy deserts, hospital deserts. I saw a model recently. I think it was somewhere in Indiana. This small town, this entrepreneur decided to put this grocery store in the middle of the town, teeny footprint. It was membership only. You had a card, you swiped in, nobody was in there. The product was all in there. Everything was on camera. The cameras were connected to the local police. They said if they got, 100 memberships in the first year, they'd be doing great. They got something like 2,500. People loved it, and they have taken care of it. So if you think about that footprint catering to that community, people being able to go any hour, what other products could you add that would be health related to the that happens to be a grocery store model? But I think about, could you take that model, depending on where you are, and do something with that model? And that way the product could come from the retailer the first time, but the follow-up purchasing could come online where you just directly mail, right? So selling more product, not less. They don't have to go. They just sign up the first time. So I do think there's a model there that I think would be very good for the consumer, lower cost, high convenience. You could customize, again, what those products and services are together into a subscription model that would work really for everybody and could solve this issue of being very, very local and part of your neighborhood. So both your online digital neighborhood and your physical neighborhood space.
Yeah, yeah. It does feel like the technology side of things opens this up to more people.
Right.
It also feels like this issue around affordability or access and affordability, and then trusted sources. That's the other thing I keep thinking about, that issue around who do I trust? We always say friends and strangers, right? And that notion of who do I trust here? Myself, as you said, in controlling the information, challenging, being a better informed healthcare consumer. But you're right, when you talk about the complexity of all the people I could be taking care of and taking care of myself or not myself, because I'm so overwhelmed with everything else, it feels like all the forces are now coming to play in this.
Right.
So it's pretty exciting if somebody can get their head
around. I think it's exciting. I do. And I also think retailers, there's iconic brands out there. People have been in, even if it's a local, if it's Belk's and it's still the Belk family in Florida, even if it's local, there's just iconic brands that have been around a long time. People do trust them. Yeah. So when you combine that with this technology and the convenience, I think there's a lot there that's worth exploring, but it's a totally different mindset probably on how we've thought about things, in the past. But again, reimagining that space is what you do best. So you have a whole company. That's all you do is reimagine the space. So I think more really exciting things to come, but I think it will keep moving. I think that this is not going to slow down. The technology won't slow down. People still need the human touch, though, and they still need to be able to communicate with somebody. That's the consultation part of this that I think is so critical.
Yeah, it is that sort of what we call the laying on of hands, whether I'm
Yes.
buying a pair of shoes or I'm, getting my
Yes.
whatever, my diabetic, my sugar level checked, or figuring out why I've got a pain from lifting too many pots this weekend or things like that.
That's right.
I think the other thing that struck me just as in closing is that we talk a lot about the pandemic and the impact it's had over 3 years. I
Right.
just marvel at sitting in an audience with some people recently and just going, how did we all get back here, right?
Right.
We lost a lot of people, so horrifically, but here we are. And then how does that, it feels to me like the long question to that, it feels to me like that forced all of us as consumers of our own and controllers of our own health to really think about what we need to do more. So it feels like that sort of pushed the conversation forward. Do you feel that? Do you feel that
I
way?
do. I do. I feel like it created a lot of momentum.
Mm-hmm.
I feel like people felt slightly isolated, so they were reaching out to people they do trust,
Mm-hmm.
organizations they do trust,
Mm-hmm.
and I think they were excited to get back out into the community.
Yeah.
So I do think it has cemented sort of retail's role in a way, but not maybe in the same way it was in the past.
Mm-hmm.
So I think again, I think COVID was a great reorganizer. You know this. The thing about being in a growth industry is nothing is high growth unless something else has broken.
Right.
I mean, that's just if the status quo, folks like me, entrepreneurs can't do anything, right? Because we get squeezed out. So all these sort of breaking points have allowed new models to emerge, new technologies to emerge, and new discussions. And what I hear from people, even just sitting at a cafe in New York, listening to people around me, they talk about COVID and how isolated they felt. And so their friendships became more important. So then could you do some of these new models with a friend? Can you bring somebody else with you? Can you create a community environment in these places? So like if you think about, oh gosh, this is showing how old I am, Wendy, but Woolworths at the counter, right?
Uh-huh.
This community at the counter at lunch where everybody knew each other.
That's right.
Right. And they would walk in and talk to you, and they sort of had a true experience, which I think is missing a little bit right now, is getting back to what that experience looks like.
Yeah. And so whether it's in New York or St. Louis or wherever you are today, I think that's a great, they're great marching orders for us all to think about that. I'm really excited to get a piece of white paper and start drawing something. I'll have to work on that one and share that with you. So it's always dangerous when I start to wave my hands around with a felt tip pen. But anyway, Susan, this is terrific. Thank you for inspiring me, and I'm sure others, to think about what the future of retail healthcare could look like. And it's time for us to shake a few more trees, right? And see what we can get done.
Okay. Thank you so much, Wendy. It's always fabulous talking with you. I appreciate it.
You too. Thanks, Susan. Cheers. So Susan made it really clear. She painted a wonderful and in many ways inspiring picture about what retail healthcare could look like and should look like. For somebody who's come out of the sort of what I call the technical side of health, as she has, that focus she brings to the role, the arc of how healthcare has moved from hospital and doctors to the opportunities we now see both in physical healthcare spaces with the technology and data we have, but more importantly, this shopper, patient, consumer lens that says, I as a consumer now feel a greater urgency and demand to take better control of my own health. So it's much less about the sort of hierarchy of healthcare providers telling me what I need to do, and rather myself as a shopper, as a patient, as a caregiver, now wanting to say, this is what I need, this is what I want, and having the tools to be able to do that. And as Susan said, this does not mean that those of you in the, vitamin aisle or the skincare aisle or the feminine hygiene aisle, or fill in any of the blanks, lose out on this story. It actually helps you embrace the consumer, the shopper, the patient in much more realistic ways moving forward, and offers you the opportunity to create real dynamic solutions. And for those of you who are sitting back saying, what's women's wellness all about? Well, she really told that story very clearly. All the touch points in a woman's life, her family's life, her parents' life, really frame up that opportunity of where do I put it and what goes in it? Well, it's everything. And to think about that lifespan is really an inspiring view to the future of not only retail, but the future of healthcare in this country. So great to have Susan help bring that future of shopping for healthcare to life. Thanks all for attending. We will see you as always in the future. Cheers for now.